guys, if you are seeing this video, that means you're probably looking up something related to chiropractors or chiropractic adjustments. So you'll probably see some weird stuff out there on YouTube. I want to give you sort of a little bit more of an evidence-based approach on what a chiropractic adjustment is. If you're looking for, you know, the loud cracks and all that crazy stuff, we've got a couple of videos of that on our page, but it's nothing that's gonna, you know, blow your socks off, I guess. So this is more the explanation of what's going on when we adjust an area. We'll tell you what it does and what it doesn't do and kind of how it should be used in treatment, okay? So I have a model of a cervical spine here, okay? So this would be like my cervical spine, all right? Now you can see in the very back here, we have these joints called facet joints. So I want to show you. The facet joints are what create the motion. So let's point to this one right here. Okay, so right here, we've got the superior articular facet and inferior articular facet, and we are creating some motion through those joints. You can see all the different planes of motion happen through those joints, okay? Now what happens in typical, you know, let's say non-specific neck pain, it's not a disc, it's not necessarily, you know, anything, you know, crazy going on, you know, in the cervical spine. It's, you know, just sort of stiff, maybe some limited motion, lots of pain, some tightness, some spasm, things like that. What happens is you can get what's called like a facet joint sprain or facet irritation, we'll call it. Essentially, you've got some ligaments around here that can get sort of, you know, inflamed and irritated, maybe stretched out a little bit, and it can resist or it can reduce range of motion at those joints, okay? So what we do as chiropractors, and PTs do this too, osteopaths do this as well, it's all the same stuff. We essentially are gonna try to identify which one of those joints is not moving like the others. Now, this is not an exact process, okay? Research shows we can be within about 1 to 3 segments of that stuck joint, we'll call it, with our orthopedic testing, with our range of motion testing, with our palpation. And typically how we do that is, you know, we're obviously trying to rule out worse pathology. Once that's been ruled out and we say, okay, this is a mechanical neck pain issue, what we do then is we assess range of motion. We see, you know, where are you limited? We know that, let's say you're limited in rotation. We know about 50% of the rotation happens at this C1, C2, atlas and axis bones up here. And so that's an area that we're probably gonna work on maybe with some soft tissue work, or we might adjust that area as well, because we know so much of that rotation happens up here. And then we'll go through the cervical spine and palpate each joint, make sure things are moving equally, generally speaking. Again, palpation is not a perfect science, but that's kind of the last thing we do to sort of narrow in on where we're gonna perform an adjustment. We're sort of getting the idea of where to perform that adjustment through our orthopedic testing and our range of motion testing. And then the palpation is kind of like that sniper approach. Like, yeah, this segment, these 1 or 2 segments feel a little bit stiffer than the others. So when we adjust, the old way of thinking was there's a bone that's out of place, okay? We are putting that bone back in place, and us, the chiropractors, are the only ones that can do it, all right? That is, I'll avoid swearing on here. That is not true, okay? That is not true, that's not happening. If that was the case, then I played football for a lot of years and took a lot of hits to the head. My neck would be all sorts of different directions, okay? Our necks are pretty darn stable. Now, compared to other regions of our body, they're relatively unstable. They have a lot of motion, not a lot of, you know, supporting structure around it. But essentially what we're kind of thinking here is, or what we're kind of applying in a clinical situation is we're taking all their symptoms, we're taking all their reduced range of motion, pain presentation, tight musculature, tight joints, and we're in palpation findings, and we're bringing that together to say, okay, we're gonna adjust this area. So let's say we identify, like, you know, let's say C3 is really, really stuck here. Okay, so we'll palpate down to C3. We'll notice, hey, you know, when we palpate these joints, there's not that much motion going on. There's not that much springiness to the joint compared to the other ones. So let's adjust that joint. All we're doing with an adjustment is we are moving with the plane of the facet. We're doing basically a short, it's called HVLA, high velocity, low amplitude thrust into that joint to create a little bit of motion, and then that's it, okay? So the most motion that happens in an adjustment is probably like this. Doot, 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 okay? We're not cracking bones, nothing's breaking, we're not putting anything back into place. It's a mobilization aimed at that facet joint, okay? That cracking noise, there's a little bit of debate whether it's a bubble forming or a bubble popping, but essentially all you need to know is it's a synovial fluid gas exchange happening, and that creates that loud pop. Just like when you crack your knuckles, okay, like that, all right? It's that gas kind of accumulating, all right? And that's what makes that noise, okay? So, that's pretty much what's happening when we adjust here. Now, what are the effects of that? So, if we look at, let's say for example, the low back, people have very bad discrimination of where their low back pain is, and like they're like, oh, it's here somewhere, and they show me a circle this big, so they can't really pinpoint it. What happens when you're in pain a lot? Your brain essentially loses afferent information from that area. It just gets a pain signal. Afferent means going to the brain, and you kind of lose sense of proprioception, like where you're at in space. When we adjust an area and we improve the range of motion in that area, what we do is we tell the brain, hey, you got 4 or 5 joints down there that are now moving a little bit better, and we're gonna follow this up with rehab too, you should be, to make sure you understand where those joints are in space, and then to reduce some of that pain as we increase the range of motion, okay? So that's called the Disafferential Model. There's a couple papers out there on that. You can Google that if you'd like. But a lot of the explanation behind the neurological effects is essentially creating a little bit of that endorphin rush, okay? So almost like what you feel when you exercise, you create that little bit of endorphin rush, kind of makes you feel nice and relaxed. A little bit of a parasympathetic input as well, just like a massage would be. It's a stimulus that is stimulating your nervous system for sure in a way that tells you, okay, relax this area. Let's reduce some tension in this area. Now that effect doesn't last forever. I wish it did, but it doesn't last forever. And so some chiros will take this to mean you need to get adjusted 5 times a week. I would say use adjusting as a way to improve range of motion in the short term of an injury. That's mechanical, red flags have been ruled out. And pretty soon thereafter, we're gonna start reducing the frequency that we adjust to hopefully get to more of an active approach. Okay, so it's just like any other hands-on approach or massage approach. We wanna do it in the short term to get that pain reduction and that feel-good effect, and we're gonna follow it up with some rehab. And after that, we're gonna hopefully take it away slowly so that we don't get reliant on it over time, okay? So that's essentially what's happening when we do a chiropractic adjustment or manipulation, however you wanna describe that, okay? Again, important points to remember. We're aimed at the facet joint, okay? We're doing a host of orthopedic range of motion and palpation tests to get to that joint. We can be within about 1 to 3 segments of accuracy there, okay? And this isn't something that has to be done every single day. God, no, not every single day. It should be done in the short term, all right? In terms of a long, if you look at the history of an injury, more so in the short term. There's a little bit of research for some maintenance adjusting over time for people that have benefited really well. You can look at some of the Nordic studies, things like that. We won't go into that today. But I just wanted to sort of make a video and explain to you with this model sort of what's going on when we adjust people. And so you know why we do it. We know where we're aiming when we go to that, and we know sort of what's happening at the mechanical and neurological level in terms of that adjustment, okay? If you guys are dealing with some pain and you think an adjustment may be something that you need, go ahead and contact us. You can book an appointment online. You can DM us, email us, contact us on the website, and we'd be happy to get you in for a consult. And we'll see you soon. Thanks, guys.